Welcome back to MedHeads, where we dive into the most pressing topics in health and medicine. This episode is brought to you by meducate.com.au. Today, we're exploring something that might make you rethink a very common class of medication, benzodiazepines. These are the go-to drugs for anxiety, insomnia, and even seizures, medications many people rely on every day. But what if I told you that for some, these pills leave behind a shadow that lasts long after they're gone? That shadow is called benzodiazepine-induced neurological dysfunction, or BIND. And today, we're unpacking the largest survey ever conducted on benzodiazepine users to shed light on what BIND really means for those living with it. Let's start with a question. Have you ever had trouble sleeping or felt overwhelmed by anxiety, and your doctor handed you a prescription for Xanax or Valium? You're not alone. Millions of people have been there. These medications are powerful. They calm an overactive brain by enhancing the effects of a neurotransmitter called GABA, which basically tells your brain to chill out. And for short-term use, they're often life-changing. But here's the twist. They were never designed for the long haul, yet many people end up on them for months or even years, sometimes without a clear plan to stop. And that's where the problems begin. So, what exactly is BIND? It stands for benzodiazepine-induced neurological dysfunction, and it's more than just withdrawal. It's a set of symptoms, neurological, emotional, and physical, that can linger long after the medication has been stopped. A recent survey of over 1,200 benzodiazepine users found that BIND is more common than we might think. These are people who were either still taking the medication, tapering off, or had completely discontinued it. And here's what they told us. Imagine this. You've stopped taking the medication, thinking you're finally free, but instead of relief, you're hit with a wave of unexpected symptoms. Memory problems. Over 60% of respondents reported issues like forgetfulness and brain fog. Simple tasks like recalling a name or following a conversation became a struggle. Emotional swings. Anxiety, depression, and irritability were common, even for people who'd never dealt with these issues before. Physical fatigue. More than half said they felt drained, with some experiencing muscle weakness so severe it limited their daily activities. Sensory overload. Bright lights and loud noises became unbearable for many. And here's the kicker. These symptoms didn't fade after a few weeks. For some, they lasted months, sometimes years. You might be wondering, why does this happen? What's going on in the brain? Well, it all comes back to GABA. Benzodiazepines flood your brain with calming signals, but over time, your brain starts to depend on the drug to function. When you take the drug away, the system goes haywire. Think of it like this. You're riding a bike with training wheels. The training wheels make it easy, but after a while, your balance gets rusty. When the training wheels come off, bam, you're wobbling all over the place. That's what happens to your brain when you stop benzodiazepines. But it's not just about balance. Research suggests there might also be structural changes in the brain, particularly in areas responsible for memory and emotion. And let's not forget inflammation. Long-term use might trigger neuroinflammation, making recovery even harder. The numbers are one thing, but let's talk about the human side. BIND doesn't just affect the body, it affects lives. Imagine losing your job because you can't focus, or struggling to maintain relationships because of constant mood swings. Many people in the survey talked about feeling isolated, too exhausted or overwhelmed to connect with others. One respondent put it this way, "I thought stopping the medication would set me free. Instead, I feel trapped in a body and mind that aren't mine anymore." BIND doesn't stop at physical and neurological symptoms. It reshapes lives in profound ways. Loss of identity. People often describe feeling like a different person. The cognitive and emotional changes leave many disconnected from the self they once knew. One respondent shared, "I don't recognize myself anymore. I used to be confident, and now I'm constantly second-guessing everything." Strained relationships. Mood swings and chronic fatigue often put a strain on relationships, creating tension with family and friends. Parents report struggling to engage with their kids, while partners may feel neglected or frustrated by the lack of connection. Workplace challenges. Cognitive fog and emotional instability make it difficult to sustain employment, leading to financial strain and a loss of purpose. A professional shared, "I had to leave my dream job because I couldn't keep up. It's heartbreaking." Social isolation, sensory sensitivities, and anxiety about cognitive lapses drive many people into isolation. Another participant said, "I want to see my friends, but I'm scared I'll embarrass myself or feel overwhelmed." Stigma and misunderstanding. Perhaps the hardest part is the lack of recognition from others. People with bind often feel dismissed, whether by doctors, employers, or even loved ones. So what can be done? The good news is that there are ways to reduce the risk of bind and manage it if it happens. For healthcare providers, start with a plan. If benzodiazepines are prescribed, it should be clear how long they'll be used and how they'll be stopped. Encourage alternatives like cognitive behavioral therapy or mindfulness practices, especially for anxiety and insomnia. When it's time to taper, go slow, really slow. Abruptly stopping increases the risk of severe symptoms. For patients, if you're currently on benzodiazepines, don't panic, but do get informed. Talk to your doctor about tapering and explore other tools for managing anxiety or sleep. Lifestyle changes like regular exercise, good sleep hygiene, and stress management can support your recovery. Seek out support groups or online communities. Knowing you're not alone can make a world of difference. This survey is a wake-up call for the medical community. Bind isn't just withdrawal, and it's not rare. It's a real condition affecting real people, and it deserves more attention. For anyone listening who's living with these symptoms, know this: recovery is possible. It takes time, patience, and the right support, but there is light at the end of the tunnel. That's all for today's episode of MedHeads, brought to you by meducate.com.au, where healthcare professionals can find resources to help improve patient care. If you found this episode helpful, share it with someone who might need it. And don't forget to subscribe to MedHeads for more in-depth conversations about health and medicine. Until next time, take care of yourself, stay curious, and stay informed.